My name is Egidio Del Fabro. I'm Palliative Care Program Director at Massey Cancer Center, Virginia Commonwealth University in Richmond, Virginia. The title of my study is Identifying and Assessing the Risk of Opioid Abuse in Patients with Cancer, an integrative review. Given the current state of pain management in patients with cancer and also the inherent risk of opioid misuse and abuse in patients who are being treated with opioids for their cancer-related pain, we decided to evaluate the literature to identify evidence for assessment of patients for opioid risk and also associations between high-risk patients and clinical outcomes such as increased opioid use, increased morphine equivalent daily dose, increased health utilization, and increased mortality and morbidity. We conducted an integrative review. The purpose for doing an integrative review was to broaden our scope, reduce errors, reduce bias, but still maintain integrity of the review. We used multiple search terms that included advanced cancer, opioid abuse, opioid misuse, palliative care, and hospice. We found 691 articles addressing opioid risk. We excluded the majority of articles because the opioid risk was focused on patients with non-cancer related pain. 34 of the articles addressed pain and opioid risk specifically in patients with cancer. We divided the 34 articles into 4 categories depending on how they assessed opioid risk. The first category was using questionnaires to assess opioid risk. We found 20 articles assessing opioid risk, but we also expanded this into articles assessing for a risk of alcohol misuse in the past and so-called chemical coping. The second category was assessing opioid risk using electronic prescription monitoring programs. The third category was assessing opioid risk using urine drug screens. And finally, universal precautions to assess and manage opioid risk. Several studies in patients being treated with cancer found that there is an association between patients who are at high risk of opioid misuse and important clinical outcomes such as aberrant behavior, prolonged opioid use, increased morphine equivalent daily dose, symptom burden, and increased health utilization. While there are currently no guidelines regarding the assessment of opioid risk in patients with cancer, our findings suggesting that 1 in 5 patients who are being treated with cancer may be at risk for opioid misuse clearly show that assessment of opioid risk is warranted. I think in future we need further research to determine whether these screening assessments, whether it be screening questionnaires, prescription monitoring program, or urine drug screens, result in improved clinical outcomes with reduced opioid use, decreased health utilization, decreased emergency room visits, while maintaining good symptom control.